Welcome to Therapy Cable. I'm Dr. Ehsan Garajadagi, a clinical psychologist, and this segment is on introducing another professional in our field on Therapy Cable. I'm very happy to have Mr. David Wiss and the Nutrition in Recovery organization here with me on Therapy Cable. David is a registered dietitian nutritionist and also a behavioral health nutritionist. And we will find out much more about these terms and what they mean and how we can benefit from David and his expertise and skills in the field of therapy. So welcome, David.
Thank you for having me.
Absolutely. Thank you for joining us.
It's a privilege.
We try to really focus on a lot of areas in terms of health and wellness when it comes to the programs that we cover on Therapy Cable. And specifically what we would like to do is educate and inform the public about holistic approaches of health. And psychotherapy is just one aspect of it. It is not the whole idea of treatment and therapy or the only way of treatment and therapy. So I'm very happy to have someone in the field who is focusing on nutrition, because that is part of our daily life and functioning. And so you have a few, I would say, credentials that are very specific and important to this field. So why don't you introduce yourself to our audience and also inform them about a little bit more about your credentials, about nutrition in recovery and what you do.
Absolutely. Thank you. So I'm David Wiss, and I have a master's degree in nutrition. My master's thesis was called Nutrition and Substance Abuse. I've done research examining the role of nutrition in addiction recovery. I'm a registered dietitian nutritionist. And before becoming a dietitian, I was a certified personal trainer. And so I have a lot of experience working with the addiction population. And I was able to see a need for very specific and targeted nutrition services. I did my undergraduate at University of Southern California and my graduate training at California State University, Northridge. And I'm now in private practice. I founded Nutrition in Recovery, which is providing nutrition services to individuals in addiction recovery, whether it be substance abuse, food addiction, disordered, dysfunctional eating, and weight management as well.
And that's a huge problem in our community and society, especially here in the U.S., isn't it?
I've heard someone say that addiction is the #1 problem in the United States.
The addiction, yes, that for sure. And also I think eating habits, simply, that's we have so much obesity. There's a high rate of obesity in the US compared to other countries.
And we're now starting to look at obesity as a potentially addictive disorder.
Addictive disorder, exactly. Right. So very good. So thank you for the general explanation. Now I have looked at your website, Nutrition in Recovery, a very impressive kind of collection, I would say, of information, research, data, resources that you can go to and learn from. So with your focus on addiction, helping addiction or people with who are struggling with addiction, what are some suggestions that you or ideas that you could share with our audience to kind of inform them how they can look at this aspect differently?
Absolutely. I think one of the first things that I noticed was that in most addiction treatment centers, there aren't nutrition services available.
That's true.
And so people come to recovery, they come to treatment, they come into a treatment facility with most likely malnourishment. So they're severely malnourished, and a lot of them need a high amount of calories. In other words, there's substance-seeking behavior. There's a lot of pleasure that's achieved through food. There's a need to restore weight. And so there is a need to eat potentially more than a normal person would. So without proper nutrition guidance, a lot of people start to go down the road of dysfunctional eating patterns, seeking reward from food, seeking comfort from food. And a lot of people will develop behavior patterns that are very difficult to break. And so I noticed that individuals with a history of addiction begin to trend towards other chronic diseases later on in life. Very, very possibly because no one ever carried the message of nutrition to them. In other words, from the research that I did, individuals with a history of addiction are overrepresented in type 2 diabetes, overweight, hypertension. And I think it's very important to carry the message very early on in addiction recovery that what you eat matters. That what you eat is not just about weight, that it affects our brains, it affects our guts, it affects our overall well-being. And as a behavioral health nutritionist, I look at the connection between food and mood, food and behavior, and make the connections between nutrition and mental health.
Wonderful. There are a few important things that are coming up that I would like to talk a little bit more about. One is, as you mentioned, this whole idea of the self-soothing habit that is underlying the concept of addiction, which is very, very similar and also kind of a core element of our nutrition. Because nutrition gives us that pleasure too, self-soothing principle. So when, specifically as you're mentioning, when people come in to treatment centers, well, we have to understand what really happens there is a drastic shift from their previous habits of using substances, more or less, to maintain that self-soothing strategy, and suddenly they have to stop that. And, naturally, people would gravitate toward food as the next more natural substance to have if you can't have what you used to have.
Absolutely.
Right? And then, but if, like you were saying, your habit is so concentrated on high calorie intake versus a more balanced approach, you are just setting yourself up for failure without knowing it. And if treatment centers are not aware of that, then they're not really doing any service to their clients. In fact, they may themselves be kind of almost a victim of ignorance.
Correct.
And what you're doing is you're bringing attention to this aspect that, it's not just the necessity of treating addiction doesn't center just around removing the substance. It also necessitates a more deeper understanding of the whole human functioning, which and with addiction with nutrition at its very core center, that can show either positive or negative outcome. And you can come in with a program, right? You would have a program to help individuals. Is that something that you would work with them like an hour a day, or what? How would you help someone who is, let's say, at an addiction center?
Well, first of all, needs should always be assessed on an individual basis.
Okay.
It's very important to provide nutrition education to the community as a whole, and then to work with individuals on a one-on-one basis.
Right.
I like to think about addiction as a brain disorder and to start using food to start healing the brain. As you stated, individuals that have reward deficiency syndrome, dopamine deficiency in the brain, are going to be seeking substances like caffeine, sugar, nicotine, other forms of addictive substances in early recovery. So when the message is framed that we can actually start to rewire your brain through food, I think people start to hinge upon that message. At least it resonates with some people. Where in other cases, the reverse is true, which is, you know what? I'm trying to get past this immediate crisis. I need to focus on only that. And I'll be ready to make dietary changes eventually. So what's important is also to plant the seed for people. In other words, at 6 days sobriety, 6 weeks sobriety, it may be very difficult for people to express willingness to make dietary changes. But to introduce the topic early on and let people know that if you do want a better life, it's available, is a very important seed to plant.
So the ones who are kind of serious about their long-term recovery, they would really benefit from paying attention to their nutrition, some kind of a planning.
Exactly.
Okay.
In the short term, people can stay sober by staying addicted to addictive foods and nicotine and caffeine. And it's an easy way to promote short-term outcomes for the treatment center, especially if we can keep our patients or our clients satiated with addictive substances, they can stay sober. They can actually have, reasonable 30 and 60 day, 90-day outcomes. But in the big picture, if we're looking at staying sober for multiple years, these are the changes that are very critical to make.
Absolutely. To give one example, I think that would be helpful. I've had a client who has struggled with addiction for many years, and then kind of going through lots of relapses, he noticed that actually at the very core of his triggers was this sudden sugar drop in his basically blood. And after he discovered that, and he worked with it wasn't even a nutrition specialist, it was like a GP, I believe, to kind of monitor the blood sugar level. But then he kind of consciously worked on understanding what food to take to keep the blood sugar level constant. Then the triggers disappeared. So he never went back. It wasn't an issue for him anymore. Drinking wasn't an issue at all. So that was an eye-opening moment for me, specifically years ago when I got into the field of addiction, that, how nutrition is kind of intricately involved in the whole addiction process. It's not just about the substance. It's not just about the, let's say, escape mechanism. It's also what our body is doing and how it's responding on a nutritional level.
You bring up a great point, because addiction is not just strictly about altered brain chemistry, but we're now looking at physiological differences that persist related to hormones.
Absolutely.
So altered responses to insulin, blood sugar fluctuations becomes a very serious issue. When blood sugar drops, people can experience depression, anxiety, and it becomes a risk factor for relapse. Right. So one of the most important things that I do is help people to stabilize their blood sugar levels throughout the course of the day, whether that means eating 5 meals per day, sometimes 6, sometimes 7, having regular feeding patterns throughout the course of the day, every 2 to 4 hours, not overeating and not undereating.
Yes.
So the mantra that I use is called never hungry and never full. In other words, we stay well fed and well nourished and never allow ourselves to enter that place of low blood sugar and high blood sugar. It's definitely smaller meals spaced throughout the course of the day to promote regularity and to just stay in a position of what I call neutrality. In other words, stop veering from the extremes of I'm starving, I'm full, the extremes, the emotional roller coaster, right? We can use nutrition to normalize that roller coaster and to get people to be able to focus on other areas of their recovery.
Absolutely. And that is, I would say, half of the formula in terms of when you're talking about nutrition and stabilization of basically these extremes, the blood sugar or whatever it is. That is a part that we may even register consciously, like the blood sugar drop itself can have a huge conscious element or impact on us. However, there is another aspect that I think also can be addressed with nutrition, which is less under the conscious radar, or it's basically under the conscious radar. I don't want to say it's really unconscious, but it is just part of the automatic, maybe the autonomic nervous system that is regulating stuff in our body, and that is the role of neurotransmitters that are linked certainly to nutrition, because a lot of the neurotransmitters we get from food. Correct. Right? So if we are, and it's not like we take a few bananas and suddenly we have a spike in neurotransmitter. It's not like that. Right. But as you explained earlier, if we manage our nutrition and our diet to at a level that is not too hungry and not too full, then we are replenishing our body with a minimum level of neurotransmitters that then would do their job, and we wouldn't have to reach for other substances to replenish what generally people who are struggling with addiction basically are deficient in. So there are like two elements. One, the symptoms that are consciously alerting us, which is like a blood sugar level drop or not. And the other ones is we may not even notice how much of neurotransmitter we have or have or don't have, but they are very directly linked to nutrition and diet.
And when talking about neurotransmitters, there's there's neurotransmitter production and neurotransmitter activity. And we know that amino acids, which come from protein, are the precursors for several of the neurotransmitters in the brain. And that's for neurotransmitter production, whereas we're looking at certain foods that stimulate a lot of neurotransmitter activity in the brain, particularly dopamine. Things like sugar, refined grains, caffeine, nicotine, salt, certain added fats for some people. And so if the neurotransmitter production is very low, but the activity is very high, eventually people are at risk for developing dysfunctional circuitry in the brain.
Right, yeah. Absolutely. And this is pretty much very scientific research behind this. That simply supports all these assertions. So it's a huge field in the general wellness, for a field of wellness that people would need to be aware of. I'm looking at your information about your recovery or nutrition in recovery program, and you mentioned it's an outpatient clinic for people struggling with food addiction, binge eating disorder, obesity.
Yes.
And this outpatient clinic, so basically, do you offer an intensive outpatient program?
Correct. So my office is located at the Source Health and Wellness Treatment Center.
Okay.
And at the Source, we are located in West Los Angeles, and we treat not only obesity, food addiction, and binge eating disorder, we also do smoking cessation. So we use the addiction model, and we have several therapists and trainers, nutrition. We use a whole package deal to address. It's an intensive outpatient, and we develop a program for individuals based upon their needs. And so we're using a team approach to address the whole person, and it's going really well over there. We have a great team dynamic.
That's wonderful.
Yeah.
So the more I look at your information, the more I can understand actually what your staff and team is doing, helping with the whole idea of addiction recovery, using food and nutrition balance, more or less. And there are a few websites that I see that are present here. Source4help.com.
Source for Help is the intensive outpatient clinic.
It is, okay.
And my private practice is located within that treatment center.
Okay.
My website is nutritioninrecovery.com. That's N-I-N recovery.
Wonderful. Nutritioninrecovery.com. It will also display that on the screen, and also your phone number, so that in our audience who would like to contact you can get in touch with you. This is a very exciting new aspect of Therapy Cable that we would like our audience to know, that the field of recovery and health is really complex. It's not just a very single-faceted type of a focus or approach. So therefore, we want to bring this information to your attention, that there are multiple different ways of dealing with wellness, with health. And one of the major ways that we are discussing today is nutrition. I have myself had multiple challenges in terms of nutrition. I'm sure every person, every human being in the world does. I have had many clients who have received great results actually by talking to nutritionists and changing their habits and their diets. Sometimes they're just individuals who work with you. Sometimes you get even a staff and a whole group and team that can help you. So David Wiss can be reached via the phone numbers and the websites that we are displaying on the screen. Anything else, David, that you would like our audience to know?
I guess I could say that I have a vision for the future that someday, very soon, all addiction treatment centers will require nutrition services. That it won't be something that's optional based on the staff's preferences. That if you want to provide addiction services, it will be required to offer nutrition education, nutrition counseling, and to really encourage behavior change with respect to food.
That would be actually a great idea. I think that nowadays, we look at diet and nutrition as a preference, as a choice. And that's why many people may just simply be kind of hesitant to look at it as an actual I would say a mandatory aspect of a daily treatment. But on the other hand, like you mentioned, nutrition education, if that is part of the treatment program, at least people can educate themselves about the pros and cons and different aspects and varieties of benefits that are available, and then make their personal choice as to maybe if they should increase more calorie intake or less calorie intake and so forth. So hopefully that will happen. We will see. So we are at the end of our program today, and it was a pleasure to have you here.
Thank you.
Thank you, David, for joining us and sharing your information with our audience. And we would like to put together a little bit more information for our audience, maybe how they can benefit from a nutritionist. So we invite you back.
Great.
Whenever you have time.
Okay.
To create more educational videos like this, maybe with more how-tos in terms of maybe top 10 list or top 5 how to do this, how to do that, how to increase your, like you said, maintain your level of, like you said, satiation throughout the day with neutrality. You mentioned neutrality. Yes. Hopefully we can put that together. And so thank you for watching. That was another professional of the day with Therapy Cable, and we invite you to look at our other programs on therapycable.com. Look forward to seeing you again.